Hey guys, welcome and welcome back to my channel. Today I'll be talking about a topic that is very important but often misunderstood: vagina discharge. What is normal and what should make you pause to seek medical advice? Stick with me to the end of this video to find out. First of all, what is vaginal discharge? It is a fluid that is often produced by the glands in your vagina and your cervix. So when this fluid is produced by them, it does a lot of things for your body, especially for your vagina. For example, your vaginal discharge keeps your vagina clean, moist, lubricated. In fact, they prevent vaginal infection. They also help to maintain the pH balance of your vagina. In some instances, the texture, the color, the amount, and even the odor of vaginal discharge can vary from person to person. And what can make this happen? A lot of things, from age to the day of menstrual cycle, if you are breastfeeding, if you're pregnant, if you're taking all these family planning birth control pills, and if you are sexually aroused. To the major topic: what is a normal vaginal discharge? I want to clear you one thing: vaginal discharge is absolutely normal, but you have to know which one is normal and which one is not normal. Don't worry, I'm going to explain to you in a simple to understand way, because that's what I love to do anyway. Now, to identify a normal vaginal discharge, it is usually clear or milky white, and it is slippery, like slippery, stretchy. You know how these egg whites used to be, usually stretchy and slippery like that, but it can change throughout your menstrual cycle. For example, if you are getting closer to your ovulation, it used to be thin, like very thin, but the moment you arrive at your ovulation, it will be more slippery, more thin and slippery, and even watery. Sometimes you tend to use panty liner during this period because you used to have this discharge more and more. Want to use your panty liner to guide. Some even use pad depending on how much you're seeing it. So after your period, after your ovulation, and you are close to your period, it gets thicker, thicker, thicker. So that's how it is. Some women even use this to track their period because they know that when they are close to their ovulation, they used to have more flow of this vaginal discharge. And another thing I want you to notice is that during this period, you see a yellowish stain on your pants. This is like that because the vaginal discharge is usually acidic. And you expect if acid touched something like this, it will leave a mark. So this acid is just harmless. It is literally helping you to protect your vaginal surroundings from infection. So it is harmless. See it as normal. It's normal, okay? Another point is that a normal vaginal discharge is not supposed to be itching you. When you are having this vaginal itching or some discharges that is making you itch, burn, irritation, that is not a normal vaginal discharge. Okay, let's take for example, let's say you are in the middle of your menstrual cycle and you notice that your vaginal discharge is stretchy, is clear, is slippery. Just know that your body is ovulating and this is a normal thing. I hope you understand this simple term. Okay, let's move to the other side. What signs will you see in your discharge that make you conclude that this is not a normal discharge and you need to find solution ASAP? When you notice a yellow or green discharge, this is not normal, especially if it is giving you a foul smell odor, something like a spoil, that kind of odor. It is not good because it could indicate a sign of bacterial infection or even sexually transmitted disease like trichomoniasis. So you need to get checked and treated as soon as possible. The discharge is thick, white, and clumpy. You know that kind of discharge that looks like cheese. This could be a sign of a yeast infection, especially if it is even burning you, it's itching you. You need to get treated ASAP. If you notice a grayish color, you know this gray color, and a strong fishy odor, itching, swelling, this could be a sign of bacterial vaginosis, and this is caused by an imbalance in the bacteria of the vagina. If you notice a brown or bloody discharge and you are not even doing your period at this moment, but this discharge is brown and it's even having blood discharge, this could be due to irregular periods. This can also be a sign of cervical cancer, although this is usually rare. The case is rare. though you need to confirm by checking with your doctor. Now, there are some common causes of abnormal discharge. You see all these discharge that are abnormal that I just mentioned, a lot of things can cause it. For example, it can be caused by sexually transmitted infections, bacterial vaginosis, trichomoniasis, hormonal changes like pregnancy or menopause, and poor hygiene, especially if you're using some products that are too harsh. If you're using products that are scented, your soap is not a mild one, you're using harsh soap, you're even using soap for vagina. All this can cause irritation, they can introduce infection to the vagina. Now, a lot of things can prompt you to go and get checked. For example, all the explanation of abnormal discharges I've mentioned should prompt you. If you are feeling pain while urinating, you should get checked. If you are seeing some foul smell around your vagina area, pain, swelling around that area, you itch so hard to the extent that you enjoy the itching, this is not a good signal. You experience bleeding, blood stain, or you are not even sure of why you are feeling all this, get checked immediately. So that is all you need to know about what is normal and what is not normal. If you have more questions for me, you can drop them in the comment section. I'll be there. As a lady, do you know that there are some period hygiene tips that every girl needs to know? Check out this video where I explained few hygiene tips that girls should never ignore. Probably you wouldn't have heard about them before. Click to find out, and I hope to see you in the next video. Bye.